Happy fall and happy back to school season. Today we're coming to you to bring you a health announcement, and our focus today is on hand, foot, and mouth disease. We're going to go over just the signs, symptoms, how to care for, and then we're going to get some updates from the school. Signs and symptoms to look for is a fever, when your child is eating or drinking less, sore throat, or just acting like they're feeling unwell. And then at some point the sores will develop. Mouth sores, sores on their hands or on their feet. They may appear as small little red spots first and then develop into blisters. Swallowing might be painful for your child is they're not eating or drinking. It's hard to convince them to keep drinking fluids, and it's super important that they stay hydrated. So offer fluids in many forms, whether it's liquid or popsicles or freezies.
And it's really important to see a healthcare provider if your child is struggling to eat, drink, if you're concerned for dehydration, if they have a fever that lasts longer than 3 days, if they are having really extreme symptoms, or they have compromised immune systems, if their symptoms do not improve within 10 days. We really encourage you to see either your primary care provider or go to urgent care or ER based on the symptoms that they're experiencing. Some management that you can do at home would be over-the-counter medications such as Tylenol and ibuprofen. You want to be sure to never give children aspirin and to always read the instructions on the back of the box for dosing. And then just remember to really keep your child hydrated. Every hour that they're up, they should be drinking something. They're not going to want to with those mouth sores, but it's really important that they do.
I'm going to talk a little bit about when your child can return to school. So one of the things that we're asking, and that it is on the exclusion form, is that the children be fever-free for 24 hours, and also that they're fever-free without any Tylenol or ibuprofen within that 24-hour period. We also ask that there are no more open sores, which means, to be checking their mouth to ensure that those sores also are healed up. And we want to also ensure that the child is feeling well enough and can participate in their day at school, because they have very busy days and they do lots of fun activities. So we just like to be sure that they are fully able to participate and have fun. Some measures that the school, we continue to have in place are, we have the daily cleaning that goes on every single day, along with the sanitizing, in order to ensure that the rooms are clean and as best that we can to make sure, that it's germ-free for the children. And Fridays are a day when a lot of that work happens, but with implementing a more formal schedule, we will ensure that the best that we can do is being done for the children. Throughout the day, hand washing is built into all of the children's schedules because we know the importance of that. And that starts out right when they enter the classroom. The children are steered right towards the fountain where they can wash their hands and then be ready to engage in their day. We also have the temp stations that are at the front so that people can access those and get their temperature checked and make sure that the children are feeling well. We have also the teachers that do daily health summaries, and they are able to review the children and make sure that they look well and that they're feeling well. Recently, the clinic has provided us with some flyers and informational material regarding hand, foot, and mouth. Those have been distributed to your children's classrooms and will be sent home with you. If your child has been absent, they'll be waiting there in your child's cubby, so you'll be able to pick them up and take them home. They're also posted in the classroom, as well as the reminders for washing hands. We are also asking that if you notice any sores or any type of rash on your child, that you will please keep them home in an effort to reduce the spread of the hand, foot, and mouth. And I know that it can be hard at times. Young children, they get sick a lot, more than the older children, but this we're trying to get it under control and to actually get it out of our building. And we need your help in order to do that, is keeping the children home so that they can get well and then they'll be able to return. So we also, in the end, just want to thank you for entrusting us with the care of your children. We love to see them every single day, and It saddens us to know that so many children have been afflicted with the hand, foot, and mouth. So we're doing all that we can to get it cleaned up and make sure that it doesn't, make an appearance again. So thank you so much.
If you have any questions or concerns or need any support dealing with hand, foot, and mouth, please reach out to our Nayashing Clinic. The phone number is 320-532-4163. And please reach out to Ask for the Nurses, and we will help support you the best we can. Please remember to wash your hands and have a great day.